Yes, ma'am.
On these discussion items, when it says consider draft proposal, is this something we're gonna discuss then and then make a recommendation to bring it to the board?
Correct.
Thank you.
Yeah. So, Director Brown is with us as a potted plant. Nothing to see here, nothing to see here. And then Opera should be trying to come in as well. I think so, yes. Okay.
Thanks for being there, Terry.
No, you can't talk to me. He's a potted plant. He's not a member of the board tonight, so unless you're just saying hello to your friendly neighbor.
I'm saying hello to my friendly neighbor.
I am the Brown Act Police.
So we can turn on the video. So we could turn on the.
Sorry.
There we go.
Oh, yeah, that makes way more sense. Okay, so.
Oh, is it not? Oh, share screen. Oh, nice. I thought I was free there.
Oh, yeah, you're on the.
Wrong
There you
guy.
go.
There we go.
Yeah,
And-
no,
It's recording.
Online.
yeah. I was just laughing because I was like,
I thought I saw her.
No, not yet. So she should be on the link I sent her. Hold, please. Yeah, oh, I sent it to her, so, okay. I'm not sure I got that to her.
And she was waiting to be let in. Okay, so I got the email.
She's doing the stairs.
Okay,
Yeah, because they have their meeting tonight, so.
she's gonna do a workout before her meeting.
she's getting her step counted.
Nice.
She is exactly getting her step counted. So we're not going to officially start the meeting for just a couple more minutes, hoping to see the committee chair and or we're waiting for one of our presenters. So we'll just kind of sing along for a minute.
In that case, I will sign off.
No
If that's-
problem. In your sound quality and everything is coming through okay on your side?
Yeah, excellent, excellent, perfect.
All right, excellent. Then we'll see you on Saturday. We'll be forwarding along the packet and a few other documents. So will you be able to access the portal as well?
I should be able to, yes.
So yeah, let us know if you need anything else. Otherwise, we'll just send you some emails and things, okay?
Sounds good. Thank you, ladies. Good job. Take care.
Thanks, Terry.
Bye-bye.
Bye-bye.
Yes, the strategic planning will be here. He's gonna be coming in remotely. He's out of state.
Oh, is he?
Yeah. He's back in Texas right now. So that's why he was zooming in to check to make sure his connection was gonna work. So, and Tim, we're gonna get started in just a few minutes. So we finish a few glitches. Nothing yet, John? That's weird. William and Bill and offer from Gary Mary West.
Oh, okay.
She just indicated she was first in the room and then. Well. Shoot.
Do you happen to know with regard to this Gary and Mary West
Pace.
space program, if this is something that the district is in favor of, how long would it take to implement it?
Month, 2 months, maybe. There's some tenant improvements that would need to be done. But they're already licensed, they're already up and running, so it's more about tenant improvements and getting things ready.
Is there a cost to us? If it doesn't show on here,
No,
I didn't think there was.
there's no cost to us.
That's what I thought.
I think so. That's why we're bringing it forward, so. Well, do you want to go ahead and get started and we can talk about the Palomar family one? And then if Bill and Ofra come in, we can at least kick back to that since
Okay,
We're waiting on them. We'll let you go ahead and
okay.
start us off.
Good evening. Thank you for attending the Strategic Planning Committee this Wednesday, May the 17th.
You're singing.
I'm going to ignore it. I apologize. Darn phones, they do that when you're not wanting to talk to them. Okay, call the meeting to order. This is the Strategic Planning Committee, this Wednesday, May the 17th, and do you want to do the roll call now? Would you like to?
Director
Open
Moraz,
up? I am present.
Director Leach,
Is absent, currently, and we're hoping that he'll come in.
thank you.
Okay, moving on to item number 2, public comments. At this time, do we have anyone who is here in our physical presence in our audience?
Not that we're all staring at you, Tim, but you know, you are the only one in the room, so.
Now's the time to say it. If not, we'll move on.
I hadn't planned on saying.
Okay, okay, but thank you. As far as anyone in our chat and waiting room? No. Okay, seeing none, we'll go ahead and move on. All right, for discussion items, before us is a consideration for a draft proposal for a senior care medical service clinic with Gary and Mary West Pace at the Community Center and Wellness Center. And
You know what, Barbara, if you don't mind, let's go ahead and go to discussion item B
okay,
instead.
for the request of our CEO, we're gonna go to discussion items B, consider draft proposal from Palomar Family Counseling Services for mental health services.
Okay, and I'll do a little bit of a
synopsis?
background on this one. Last year, we started an initial conversation around having certain programming that the district wanted to be able to bring forward, but that didn't fit really well within our grant process. And one of the needs that we identified from Catalyst was a need for mental health support services for district residents, not just school age, but just overall more access for mental health support. So in a conversation with Palomar Family Counseling, which is a long-standing partner,
Yes.
that we also know has capacity to scale up to offer additional mental health support.
Nice.
Right, because we know that many of our federally qualified health centers, or FQHCs that serve this community, did not have the ability to scale up. So this is the proposal that they've put forward. The goal of the pilot project, and you have in front of you, oh, you have it on the screen, perfect, to improve the mental health of our community, expand access to affordable professional services across the continuum of care for prevention, treatment, recovery, reduce or eliminate the stigmatization of seeking mental health services. So the expected partnership with us is that they would provide licensed therapists, associate therapists, or graduate interns to offer individual, family, and or group counseling services at the Wellness Center at fixed times during the week, and that they would schedule these times in association with the center. So basically, the expectation is that they're willing to work with us to find the best time and space, right? Secondly, that we would help to essentially announce or put forward the fact that these services are available at the district's wellness center. That would be part of our responsibility, is helping to promote it. And that then we would fund during fiscal year 23-24, the fiscal year we're about to start, certain number of hours. So what they've done is they have essentially provided us a slow build to a maximum amount of 24 hours per week of services to the community. And the expectation is that those services could be available to anyone in the district, would have to be a district resident, would be able to sign up and come in for those hours. This would mean that they don't have to already be a Palomar Family client. It means that whether they're insured, not insured, underinsured, insured elsewhere, but can't get in to see a therapist for 6 months, they could still use this service. And the idea is that during the first quarter, they'd offer about 6 hours a week. Second quarter, they would jump that to 2 therapists, each doing 6 hours a week. Quarter 3 is 2 therapists doing 2 days a week. And then fourth quarter, 2 therapists doing 2 different time periods. So basically what it does is it allows us to increase the amount of services that would be available so that we could build and make sure that there's enough advertising around it, and or potentially determine how much need is actually out there.
Did they indicate how they would go about triaging for?
No, that would have to be under their own policies. So
Are they going to focus on specific content as in, say, stressors in the workplace or
they're
dysfunction at home?
they're not doing educational seminars. These are actual one-on-one counseling.
I see.
Or group counseling or family counseling. It's not so much educational seminars. They already have some of that they've provided us
Okay,
education on.
and their expertise has been so far with the school and the children, correct?
Right. Well, they also do family and individual counseling through their office here in Fallbrook as well. And of course, in their main office out of Escondido. The idea is that they're just gonna bring additional therapeutic hours to the wellness center, and we would basically serve as kind of their satellite office for
I
that.
see. And this dollar amount that they're projecting here, the
Mhm.
35,100, that's for an annual.
That's the proposition for the 1 fiscal year as we bring up the number of hours. So the proposal to us is whether or not we want to go with all those hours, offer some hours, not all of them. Again, because it's a draft proposal, the expectation is that it could be, we want to just offer those 6 hours the 1 day a week.
So we're reimbursing them for providing these services.
We're not reimbursing, we're just gonna straight up pay them.
We're going to pay them for these services.
Correct.
Now, they're going to provide them at the wellness center, and are they planning to put their sign up?
We would probably have some version of signage so that anyone that's coming to the center could be able to find them. Whether or not it's something permanent, I don't know. We haven't, figured out what that would look like. The conversation we had is that we would initially use 1 or 2 of the bedrooms of the House of Wellness, because those are the perfect size, like therapeutic
Yeah.
private rooms.
Well, should it grow into something that's being, that has momentum, we would consider doing a partnership with them?
Well, this is the partnership.
Oh, I would see that this would be a trial run. to see
Well,
how
I
it
mean,
works out.
as far as partnership, are you thinking we would expand more
Well,
or?
I'm all for expanding services and providing the availability. As far as them using our facility, are they going to reimburse us for that?
No, that's what they're, we want the service in town. So they're basically giving us a less expensive fee to do that in lieu of a rent.
Okay, and are they still going to have their,
Yes.
okay, so this is be like a satellite office?
Yes, except for that office is primarily for their current client base, where the one at the wellness center is more of a general community wide.
Okay, how can we help get this up and running with a PR campaign to indicate that?
So the PR campaign, I think, is something that we can, with the new outreach communications person and with Mike's plan through public engagement committee, I think the advertising and promotion of the program won't be the problem. I think they'll probably fill those slots pretty immediate.
I think so.
Yeah.
I think so. I think it might be a little overwhelming, the response that you're gonna get.
I would agree, which is why it will be their business practice to figure out how they would triage, how they would prioritize. They already do that in their centers, so it's probably best for us not to try to muck with that.
Yeah. would we be able to let our physician component here in the community know that we have this available? so
Oh,
that they can
absolutely.
refer their patients over? Because a lot of the services that, these, that are within the network they're out of town.
Right, well, and the initial conversation that I had with Palomar when we talked about this is they're fully aware that many of the hours they're offering would literally be more of a soft handoff, right? So let's say Raquel is having a challenge, sorry, Raquel's having a challenge and she calls the therapist that is linked in through her insurance and they say, we can see you in 2 months. Yeah, right, and she's thinking,
You can't tie a knot in your rope and hang on.
right, so the idea was Palomar Family Counseling could be that first
Yes.
soft handoff where she can then come to a district-sponsored program. Have somebody to be able to check in, talk to, get started with support, so that when her insurance comes on, they can then do the handoff.
Yeah.
Right, that was one way to fill this gap. The other is for those folks who don't have any insurance or are underinsured or need other resources. They may come to us, we'll get them through to Katya. Katya can say, okay, we've got you, we're gonna get you into Medi-Cal. Medi-Cal maybe can't see you for 6 months. So here's a soft handoff again. Right, so the idea is that this isn't your permanent, regular, standard therapeutic preference, but the idea is this is the soft handoff.
I think it's a great idea.
I mean, that was the initial primary goal for all these folks. And then, you know, if it turns out that they need longer term resources, then Palomar Family Counseling would work from within their process to get folks into their system, and then maybe they would be moved off into their more traditional therapy route out of this office or the Escondido office, something like that.
Sounds wonderful, really does. Well, I think it's a good idea. I would think it would be something that the board would need to take a look at.
Oh, of course.
Definitely,
Of
and
course.
consider, adopting this or making their recommendations to augment it one way or the other.
And really the main point was that this was one of those high need priorities that came out of our Catalyst report that we don't have a way to be able to support. So mental health first aid has been a great program to really do this more surface broad level.
Right.
But we knew that we had some deeper need.
Mhm.
And so this is one way that we could start to address that deeper need.
I would agree, and I would also recommend, for our wellness center and for the programs that we're gonna do in the future to really. Well, we can discuss it at the strategic workshop this Saturday, but one of the things that I'm noticing is, while Catalyst had accurate data at the time, I think where we are now is our priorities are the same, but some of them have shifted. Some have more urgency than the others.
Yeah, and that's definitely part of Saturday's conversation.
Yeah,
Yeah,
and right now I'm feeling and picking up, not just in our community, but it's coming from all over. There's a general lack of trust in what's going on. People are anxious.
Yeah.
Because they don't know where they can find the truth. And of course, it's the universal question, what is truth, where's the truth? The bottom line is, if you have coping skills to keep yourself grounded, you will find your way, whatever that way is, and whatever your truth is. But it's the idea of dealing with the stressors of the aftermath of a pandemic, the aftermath of a fire, of the aftermath of an earthquake, the dynamics of the catastrophe, how we can help each other as a community to stay supportive of each other.
Yeah.
And stay calm and focused, because it's real easy to go, the sky's falling, the sky's falling. And that's what I would hope for the community and the wellness center to
well,
say.
and we had recently some coping after COVID seminars. We've had some stress one of the programs that Teresa is still working on is bring the mindfulness, meditation
Based
stress.
mindfulness-based stress reduction.
Yeah,
Thank you. I knew I was gonna get the name of that program wrong. Bringing those specifically to try and address some of that ill ease.
yes,
That we've
there's a lot of,
seen come
yeah,
forward.
unrest about what's happening, you know, from the financial profile all the way down to real
Yeah.
estate and what's going on in our community. Sounds like a good idea, and I think it would be well received, and we can discuss this. I think we should definitely have this as a topic of discussion for our workshop this
Okay.
Saturday.
Well,
as well.
we have it as one of the kind of sub pieces. So we'll bring this, actual proposal forward to the Saturday workshop.
Mhm.
And then it'll probably end up on the main June, board agenda as well, depending how Saturday's conversation goes.
Okay,
Because I know that, the only thing I do know is Bill, had some questions about the cost, and the overall willing to support to that dollar amount. So that might be a point of negotiation. But I think to your point, the board might want to weigh in.
well,
On that?
absolutely. I mean, if I could, I would say, let's do this, and in tandem with that, I would grab our local physician-friendly urgent care provider to see if he wouldn't want to do a presentation at the Wellness Center on specific topics that would be beneficial to the community.
We can always ask.
And if not him, we can extend the invitation to other physician providers. I mean, they're all busy, I know that, but
Yeah.
every so often we could get lucky and have someone come in and do a presentation on, you know, aging parents.
Well, and I think that's a topic for another discussion that
Mhm.
we need to agendize, but I think that's part of something we should talk about maybe on Saturday for some of the different program recommendations or service priorities for
Right,
Saturday though.
yeah, and the other thing is just take a stand to refer to your primary care physician. I mean, we can have information, but general information,
Yeah.
not specific.
Yeah.
Because we don't have the license, you know, as we did at the hospital to provide medical services, which I still wish we had because we could do so much more.
Yeah.
But being the wellness center, we want to be able to provide as much information and accurate information that is current so that they can have resources to address, to try to do sort of their own problem solving, because the whole focus is to get people more engaged in their own health and wellness as a singular person, body, mind, and spirit. That makes a contribution to your healthier family, your healthier community, you know, etc. Because this has just been a really tough time this past couple of years.
Oh, yeah.
And I don't know any family that hasn't been impacted by something that happened with regard to the pandemic and its side effects, et cetera, and the concerns with the vaccines, et cetera, and now what's gonna happen. And so the idea is to, like the British say, stay calm and carry on.
Yeah.
Tea
All right.
for everyone, okay?
So we'll move this to Saturday's, under Saturday's topic for priorities of programming at the Wellness Center.
Okay,
And then, it looks like we do have Afra with us today. She joined us on Zoom. There she is. So, hold on, I just see a note coming through from Bill. He is not gonna be able to make it. Sorry about that. So,
okay,
Afra, I'll do a very gentle introduction and then I'll let you jump in and talk about PACE. So what you've got here is our original sort of white paper discussion. This has been to committee once. So Barbara, you should have already seen this a couple months ago, right?
I'm familiar with it.
Right, and so we've been going back and forth, and Afra's been working with West Pace on what they would need and what they would like to propose. So Afra, I'm gonna let you launch that and tell them what your options are. How's that?
Sounds good. Hi, everyone. Good evening.
Good evening, thank you.
Nice to meet you. I'm working intensively with Rachel, keeping her very busy with the back and forth constantly, but it's all for a good purpose to try to be more accurate to what we believe that the community will benefit from as a mutual kind of endeavor together with West Pace. I know that you are familiar with our previous proposal that was talking about us having some sort of a clinic at the wellness center with every day dedicating about a couple of hours of services to the community, the older adults community, regardless of their, pay status. So we will be open basically for everyone 60 plus that needs services that we can provide in the clinic. We had some internal discussions, and I think we got a very good feedback from actually our financial team. And their feedback was that they think that a couple of hours to be open to the broad community will not bring the right amount of traffic that we would like to see coming into this type of clinic. We need to be more open to walk-ins and people trickling in during the day, so we can, increase our visibility in the community and maybe potentially enroll more people into PACE if they wish to and are eligible. So I came back to Rachel with a little bit updated proposal that we will actually operate the clinic 5 days a week for 8 hours per day. And during these hours, the clinic will be open to both PACE participants and walk-ins. So we will have more traffic and, people regularly using our services. And this will be in exchange of us being able to operate in the space with not paying rent. So basically we're operating it the whole time, both open to PACE and the community in this type of deal.
And I'll add in here what we were talking about basically is this is essentially an in-kind trade. So we would offer up the space and they would be able to offer more open hours for any senior participant to be able to come, whether they're PACE or not. So by them extending more office hours to more folks, that allows us to not potentially need to charge a rent. So that's where we came up with this balance of in kind, if you will.
Yeah, doesn't mean that we will have a provider there, obviously, for all these hours, but we can see people during these hours, maybe do some light triaging and schedule them in when we have a provider, if they need to see one and they're unable to go to see their regular provider or can't travel. So basically it will be more of an immediate response and interfacing with people who have needs. We would also like to work with the district about the hours of operation, so we know that certain groups will not be able to come during work hours. So maybe we need to kind of change a little bit the opening hours to better accommodate the needs of the community. But yeah, that's basically the updated proposal that we came to Rachel with.
And Barbara, what you may recall, when we first brought this white paper, there was interest in bringing it forward and having a little more conversation. So I went back to Offer and PACE group and we talked about, we had an initial interest. What else could they offer? And Offer, just so you know, the proposal she's got in front of her is our original one that has your little blue graphic, which is a reminder that they would be able to also bring some of those different mobile services. We talked about a different rotating set of potential clinicians. So it wouldn't be every day, all of these services at once, but there would be rotating. The idea is that it would not compete with our urgent care provider. It would not compete with our overall community providers. It would be supportive and supplemental to that. So I just want to make sure to remind that part of the conversation.
Exactly, and we will be able, because we will have a person there, we will be able to facilitate these relationships better. And, communicate with other providers, make sure that, people are connected. If they're not connected, we can help them get connected. And since we have now a contract with the adult day program for our participants, then I feel that there's a lot of synergy that we can build with them as well. For example, I talked and we discussed the fact that in their operating hours, we could see people who need some type of an emergency care, need like wound care or other things that now require them to take people outside of Fallbrook. And when the clinic will be open, this is something that we will probably be able to address there and save people some unnecessary trips. And, this kind of situations will be resolved much easier. And because of the relationship that will be there, we could work more in tandem together.
Yeah, and what she's referencing, Barbara, is that West Pace has contracted with the Foundation for Senior Care for their adult day program. So the adult day program may have West Pace clients. And so that's just gonna facilitate some of that local support to those patients as well.
Okay, may I ask how you would facilitate, say, a dental or vision need? Do you do assessments? You're like case management?
So, right now, the way that we operate with the dental clinic is that we actually have a mobile clinic coming to our location, providing services there. And we do contract with them for a full day, which means that we can do the same with the district, kind of, do a joint venture of bringing the mobile clinic on site. And basically we pay for the full day, but we can schedule as much appointment as we can, during the day. So we're basically paying for a whole day and not per patient. This is something that we still need to explore. It depends on the number of PACE enrollees that we will have on site. But basically what we would like to do is be able to bring all the services to the community, as opposed to mobilizing people right now to our center in San Marcos. The transportation is becoming to be a huge barrier for us as for other people in the community, I'm assuming.
Yeah.
Yes. Okay. And with regard to a vision, you have the same type of application?
So for vision, I'm not sure yet how it will look like. These are all things that we need to explore. What will be the right structure for us to do? Because these are all services that we either provide directly or we're contracting to provide for our PACE participants. What we want to do is be able to bring them in for our participants, but open them at the same time to the broader community. Six plus, obviously, because we are focusing on older adults. But yeah, that's the general idea here.
That sounds wonderful. That sounds wonderful. Again, we'll be discussing this at our meeting.
Yeah, we'll discuss this a little bit, not as in-depth on Saturday, but we wanted to make sure, we knew that there was already an initial buy-in, but I wanted to, bring Afra into the conversation.
I love the concept. I really do, especially for the seniors. All I can say is roll your sleeves up, because the boomers are getting older. And
I'm talking a lot with Rachel. There's so many synergies that we can build here.
yes,
And the idea for us is not to focus just on PACE. We want to be a meaningful presence in the community. We want to be able to look at this community in a way that we can serve in a broader aspect than just the PACE population. Obviously, we would like to enroll people to PACE. That's part of what we are intending to do, but we also want to be part of the community. And we want to be recognized as a good, reliable provider for older adults in all aspects of need, whether it's a diabetic clinic or behavioral health or primary care or, you name it, we do touch it. So we have the capabilities to do that.
And you have facilities in San Marcos and Escondido?
So we have our main center is in San Marcos. We do have an alternative care setting in Bayshire. at Carlsbad, and these are the main location that we have right now. We are looking into expansion to other areas, and I think that Fallbrook is one of our top priorities. So, you know, we see it as a potential for a growing partnership with our ability to identify more and more needs of the community.
Yeah.
So-
One of the best synergies is the fact that PACE already had a relationship with the Foundation for Senior Care. Now we could expand a relationship. So being able to bring all of those services together in one little community is our unique opportunity together.
It sounds very, very, well thought out. I'm glad that the other facilities are working so well for you. I'll bet you're busy, very busy, I would imagine. And it sounds like something that Fallbrook could really use and appreciate. So I would recommend that we would bring this to the board for further discussion on this concept and see if we can't get some more input from our board members to see if we'd like to move forward with it.
Excellent. Well, then what we'll do is we'll bring it to, again, just a little more conversation to Saturday's strategic planning workshop. We'll talk about it there, and then we'll bring it forward to the June
Okay.
board meeting. So I'll connect back with you, and we'll just update this initial white paper with some of the new info and bring that forward. So we basically have the initial kind of head nod to it from this committee, and then it can go to the next. So, and
We'll work on updating and sending you something so we can have a back and forth with that.
perfect.
Awesome.
Yeah.
Thank you.
All right. Thanks for coming and joining us on Zoom tonight, Opera.
Much for having me. Have a great
All
day.
right.
Thank you
All
very
right.
much.
See ya.
That
All
this is specifically addressing seniors,
Mhm.
which is, this is gonna be just really well received.
Yeah, and PACE programs overall are generally really, they're really well thought out, because the fact that they have that inclusion
Mhm.
component, right? It's not just disconnected healthcare from your primary, and then over there is this other service, and over here is the other service. The idea is that it is inclusive.
Mhm.
So that case management, which is such a big, important part,
That's really key.
really important. And then they'll serve the Medicare, Medi-Cal partners. So that's really a lot of those seniors who fall below the gap and haven't really been able to get connected to
Well,
some of the bigger
Just,
services.
just dental alone. I don't care what insurance you have.
Yeah,
Especially if you're diabetic, you've got issues to begin with. You're gonna
right.
have eyes and mouth, they tell you that.
Yeah.
So this is a really special area that needs attention, and a lot of it.
Yeah.
And people they don't wanna address it, you know?
Right, well, and that's part of the reason that the DPP program that we're doing is so important, is if we can capture those folks while they're still pre-diabetic, and really change lifestyle so that they don't go into full diabetes.
Right,
We can impact life and health for such a long period of
but the
time.
cost is what I'm saying, the
Oh,
dental
yeah.
costs at this point in time, I would say, are almost prohibitive to seniors.
It's any-
It's just, I mean, yes.
Yeah,
Even if you have insurance, it's like, you might as well take a mortgage out on your house, because.
well, and that's if you can find a good provider, and finding enough providers we know in town is difficult. So one of the best benefits that I saw is the fact that West Pace is able to bring forward their entire contracted group of providers and bring those services to Fallbrook in a way that no one other entity can. So
Have you visited their facility?
I have not been to their PACE program. When they first introed it, we were getting ready to go, and then COVID hit and you couldn't really go. So now I need to go back and do a
Yes,
full
before we
visit.
have our June meeting, would you be able to facilitate a visit to their entity?
To do a tour?
To do a tour, take a look, see, so
Yeah.
that you've got more
Do
information.
you wanna be part of that visit? As part of
Absolutely.
this committee, that would probably be a great
I
idea.
would love to be
Yeah.
able to see
Oh,
how
yeah.
they orchestrate this, and then you've done your due diligence, and you bring it to the board, and you say, look, I've taken a look, and here it is, and this is my recommendation, or the strategic planning is saying, this is something worthy of consideration. And so that just gives you more.
Yeah, I mean, I've been busy looking at business plans and financials, so I didn't actually
Well,
look
get
at
your head
their facility.
Yeah, no, it's watching how these things, actually come into play, because it's like when you have a theater, the script versus the play. Sometimes it reads well, but you can't produce the things that you like.
Right.
So you want to just kind of preview coming attractions and do your due diligence.
Yeah, well,
Some of
we'll-
these concepts are really wonderful, but to try to orchestrate and organize them to come to life is, as we can't expect everything to be a successful outcome, so we just want to be
Yes,
prepared.
we
But
can.
the wellness center, we can. We
For
can
sure.
be very careful about what programs we want to bring on board and be a part of what we do. And something that's gonna be well received by the community, and I'm telling you, this one, this is like, oh, yeah.
Right?
Yeah.
So we'll bring both of these as just part of Saturday's conversation about those priorities for upcoming programming.
Uh-huh.
Because while they're not necessarily our programs, they're on our site, so they would be district sponsored.
Okay,
And then we will presume that we'll bring those to the June board meeting as well, depending how Saturday's conversation goes.
yeah. Oh, I see this developing into something good. I'm seeing, as this progresses, having the ability to communicate with our local newspapers, some kind of a medical forum from an authorized medical entity or provider about specific things like, if there's something or other that's going around in the community, or if there's an incident that we need to be aware of, with regard to,
That gives us that access to those clinical partners, to be able to help bring more of that information forward.
because
So-
I find that that's probably the most difficult thing, that most of our covered individuals who have insurance, when they go see their doctor, they are only aware of talking to their doctor about that one thing that's going on with them. And they don't really have a resource to find out what else is going on. And I don't know what the CDC has anymore that is current. I would love to see them, purge their files and start coming up with something that's dated this year, But you want to get accurate information to the community with regard to healthcare issues, whatever they may be. So I think this is a good idea, and yeah, we should definitely do a site visit out there and then bring it to the board for evaluation.
Yeah, I'm sure that Offer and the team out there would love to have us
Yeah.
do a site visit.
And-
So,
When your schedule can come.
oh yeah,
'cause-
we can always find a way to make that happen. So I'll connect with them and see what we can do. We'll probably, it's tough to get Bill on site visits just because of his work schedule. So what we may do is maybe reach out to Mike as part of public engagement,
Absolutely.
or Terry or Jennifer from finance. So we'll see which other board member can potentially go. So it'd be
Yeah.
nice to have at least two of you there. Well, we can only have two of you there,
Yeah.
so
That'd
yeah.
be great. That'd be great.
perfect.
Okay.
All right, well, I think that just puts it down to any other comments or future agenda items.
Okay, so, any other,
Well, if you don't mind,
I think right now it's not such a crowded room. If you got some comments.
I was just thinking here, I was on the board of the senior center 9 years ago. At that time, we were talking about opening a discussion with the Foundation for Senior Care about a merger. But there was suspicions among the senior center board and members that thought the Foundation for Senior Care was just after their endowment. So I mean, there's these sibling rivalries. And services in Fallbrook are so balkanized. Because we're not a city. And when you're a senior, I mean, you really don't have much support. And there's this discussion about PACE. Roy Musa the other day was saying that the transit service, the RTD is going to do a bus stop at the food pantry.
That's already in place.
Right.
Yeah.
There is a woman that I know at the senior center was doing this petition, who already submitted it to the supervisor about the need for senior transportation. There's been a discussion about how do we get people to the wellness center. You know, maybe this district would be a good sort of a organizer of how do we unify senior services in Fallbrook? Maybe everybody could kick in, say, $5,000, hire a consultant. I mean, the demographics of the senior center did a study into the future. And because now they're only serving a very small percentage of the senior population, but they don't have the facilities to get more. So they're really at a crossroads. They did this big study by a nonprofit that probably is just gonna sit on the shelf because they don't have the vision or they don't have the money really to do anything. So, I mean, it seems sad that everything is so helter-skelter.
Well, and Tim, if you don't mind, I'll let you know that, I did sit in on that focus group when the senior center had
Yeah.
the senior foundation, San Diego Foundation, their senior
yeah.
foundation.
Yeah,
I sat in with them. I met with Joan and Susie from the
Oh,
senior
yeah.
center
How long ago was that?
was that last week? That was last week. And then I have a meeting with Patty Sargent, with the Foundation for Senior Care on Friday.
Oh, okay.
So we do work, actually quite a lot behind scenes to try to
Right.
figure out better ways
Yeah,
to integrate some of those conversations so that those gaps in care, they each may have a solution that hasn't been brought forward together.
Mhm.
So we're working to try to help facilitate that part. And then I do sit with, with Desmond's revitalization committee
Yeah.
for the senior services. I sit on that one as well. So we are there. The district has to serve the entire district, so all of our demographics, right?
right, yeah.
But we do want to make sure that we have a voice
Mhm.
in that because we can serve as that advocate.
Yeah,
So we are serving that role to some
I
extent.
was just going to say, I don't know, when you were interfacing with the senior center in the past, but they have changed dramatically.
oh, yeah, I know they have. Yeah.
Okay, and it's been for the better.
Yeah.
So I'm much
Oh, yeah, I
more
remember.
comfortable.
I served during the Manny Ortega years.
There you
Oh,
go.
yeah.
We had this, yeah, okay.
Yeah.
But a whole different set of dynamics are in place now, and you've got, the people that are attending the senior center are not the same people that are attending
The foundation.
the Foundation for Senior Care.
There's some.
There could be
some of them.
but the
Yeah.
needs, this is about socialization, entertainment, interaction, community engagement, having a luncheon, having recreation, and it's all about having senior activities that are healthy, and these
Right.
people are very self-sufficient and independent. Whereas those that at the foundation have had a diagnosis of some sort that are working with
Well,
the
the
families, they need,
day program
they,
participants.
right, but
Yeah.
they have been in need of a case manager, if you will, for their health, the particular
Right.
health conditions. And God bless them for the job that they do and the work that they do, because I'd still like to see more working from the medical groups with the Foundation for Senior Care, because
I think we all would, yeah.
it
For
is
sure.
needed, and it's aging, it's not a disease, it's a process. But gerontology is something that the families need to know, this is the stage of life that we're all gonna go through. And so give them coping skills, give them the access to the care that they can help make their lives more comfortable.
Yeah.
And being alone, left alone is the worst thing for them, because that increases the more negative medical conditions that can occur, and mental health issues as well.
Yeah.
For
So-
example, the other issues is these people that I know as an example, Dale and Isabel, they were very active when they were younger. Now they're older, neither of them can hear. They both fallen into bad health. They don't want to drive anymore. They contacted the Foundation for Senior Care and was told it would take 2 weeks to get a driving reservation. So, I mean, that really points to the need. There's no taxiing down. The bus goes back and forth to the Vista, transit center or wherever.
Yeah.
So, I mean, it's just,
Yeah, the out of town transportation, which is all volunteer led, is really
Yeah.
difficult for them. It's really difficult for them.
yeah.
Yeah. There is no good, easy answer for that. That's the problem with living rural, obviously.
Believe me,
Yeah. So
we're doing our best to overcome it.
yeah, we're in those conversations,
Yeah, good.
looking for longer term vision and strategy on that.
Good.
So
Thank you.
we don't often talk about that because
Yeah.
it's such a quiet work, it's a slog.
Yeah.
You know, it's gonna take a long time. It's gonna take a long time.
But it's
but
getting better.
We're having those conversations with them. I know that Jack, Jack Turner, when he was out at the public forum conversation, he's interested in having the senior center in the district be able to do
Yeah.
more social collaborative events out there.
Yeah.
So we're looking for them to bring the lead on that forward. So I think those are all
Yeah.
comments that we're trying to address as well.
Thank you.
Yeah.
Thank you. Okay, board member comments and future agenda items. I would like to say I have nothing else to add at this point in time, knowing that we're going to have this workshop
Yeah.
on Saturday. And I think that from there, if we have any further items to discuss, it will be brought forward and presented at that time for our meeting in June. So if there is no further business that we need to discuss, I'd like to thank you all for attending this strategic planning committee meeting. And I will adjourn it at this time, I think by
28.
6:28. 6:28.
Done. Perfect.
Thank you,
Okay.
Barbara.
Thank you.
Thanks, Tim.
Thank you.
Right, excellent.
Um,